Hi, this is Dr. Bharadwaz. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on one of the common disease and one of the most important disease from the perspective of neurology, that is cerebral palsy. Cerebral palsy is considered as the disease of neurology or nerve disease. It affects the ability of the movement. It affects the movement. So sometimes they cannot move. Even though they move, they cannot move properly. All this is due to the brain damage. Somewhere during the birth or before the birth, just after the birth, there is a brain damage. Because of that, it affects the movement of the patient. Then we call it as cerebral palsy. The most problem with this disease is people think that there is no treatment for this disease. Yes, from allopathy or western medicine or english medicine, or when you go to a neurologist or neurosurgeon or to a corporate hospital, there is no treatment for this disease. It is just symptomatic. But with homeopathy, there is very good treatment. The quality of the life of the patient can be improved. The dependency, so these people are dependent on other people. For example, your loved ones is dependent on you, or your child or your daughter or your son is dependent on you. This dependency can be decreased or sometimes completely removed with the help of homeopathic treatment. And also some patients will have a lot of pain and discomfort because of this disease. Even this can be decreased with the help of homeopathy. Homeopathy has a very good scope, and success rate of homeopathy in this disease is very high compared to other neurological disorders. Basically, you have to remember homeopathy is the best choice for you for this disease, and the scope of homeopathy is very good, and the success rate of homeopathy in this cerebral palsy, it may be various types of cerebral palsies. The scope and improvement rate or the success rate with homeopathy is high compared to any other system of medicine. Coming to the signs and symptoms of this disease, you can see first, it creates problems in movement. Sometimes people cannot move. Even though they move, it will not be coordinated, or they will have involuntary movements in the voluntary movement itself. So there are a lot of movement disorders. Primarily it is a movement disorder, so it helps wrong gait, or they cannot walk properly, they cannot sit properly, they cannot stand properly. Lot of movement problems will be there. Apart from that, they may have pain anywhere in the body or anywhere in the joints, especially upper limbs and lower limbs. They will have pain due to spasticity of the muscles. Intellectual disability, some of them are not so intelligent. There are different types of intelligence, and the intelligence may be reduced or completely diminished in some of the patients due to brain damage. There can be problems with speech and language. They can be stammering, they cannot speak, vocal cord paralysis. Lot of things can happen related to speech and language. Sometimes they cannot understand what some others are speaking, or sometimes they cannot speak properly. Even though they speak, it is not clear. There are a lot of speech problems and language problems because of this. Next one is epilepsy. Epilepsy is normally known as seizures or convulsions or fits. These are involuntary movements due to temporary loss of consciousness. This is known as epilepsy. This can be along with movement problems. Visual impairments, they can be double vision, dim vision, lot of visual, so they cannot see properly, their eye muscles are not coordinated. Lot of visual disturbances can be there. And also bladder problems. Bladder problem means urination problems. They cannot withhold the urine, or they cannot void the urine frequency, urgency. Lot of things that can happen. Involuntary urination, lot of things can be happen due to bladder problems. All these problems are associated with movement problems. You have to remember, movement is the main one. Along with that, you will have symptoms. You will have sleep disturbances. These people cannot sleep properly, or they sleep for a long time, so they wake up in the middle of the night. A lot of things can happen during this problem. And also hearing impairment, there some people cannot hear properly, even they need speech therapy as well. The next common symptoms we found is hip displacement. So the muscles around the hip are problematic. They are very rigid, they are tight. Because of this, there can be involuntary movements. All because of this, they can damage the hip movement, and we can see it as hip displacement. And also you can see behavioral problems. Behavioral problems is they cannot understand what is good, what is bad. Morals are lost sometimes. And also there can be mood disorders like depression, anxiety, or you can see lot of mood disorders or behavioral problems with these patients. Next, coming to structure and function of the brain. So there are some important brain structure and function you have to understand before going deeply into the further session. There are three main parts in the brain, or three main structures of the brain that are going to be affected because of the cerebral palsy. First one is cerebral cortex. We will see that what is cerebral cortex. Especially there are different types of cortex. In that cortex, the special one involved is cerebral cortex, and also basal ganglion. Basal ganglion is also structure within the brain that is going to be impacted or damaged because of cerebral palsy, and also cerebellum. So these are the three important structure we will learn about it. So what is the structure of cortex, basal ganglia, cerebellum, and what are their functions? When we study this, what will happen is we can understand if this damage, this function is lost. If this is damaged, this function is lost. If this is damaged, this function is lost. So you can go deep into it. The main thing is there are three structures. One is cerebral cortex, basal ganglia, and cerebellum. We will look deeply into each structure now. First structure we have to understand is cerebral cortex. Cerebral cortex. What is cerebral cortex? Cerebral cortex is the gray matter. See, this is the cross section of a brain. I'm standing here and think that my brain is cut exactly in this coronal section. So, and I see the brain. When I see the brain, this is the brain section. You can see here, this is the brain structure. See, this is all white here inside, right? And this is all white here. Inside is white and outside is gray. Gray color is the accumulation of neurons. Neurons means body of the neurons. So there is a nerve cell. Nerve cell will have a body and it will have small extensions, axons and dendrons. These axons and dendrons are white color, and the body of the nervous system or the body of the nerves is present in this gray matter. This gray matter is known as cerebral cortex, especially on the upper part. All this gray matter you can see here, right? So this is known as cerebral cortex. This is the gray matter that is known as cerebral cortex. So what are the functions? Why do we need this cerebral cortex? First one is voluntary movements. When you want to move or when you want to catch something, pick something, so you are doing it on your will. So that is the voluntary movement. That voluntary movements are from this cerebral cortex. And also planning of the movements. Before, for example, I want to catch something, right? I want to take a pen. I need to plan it in my brain. Even though you don't think, you have to plan. So I need to put my hand here and pick up the pen. Even that planning is done by this cerebral cortex. And execution of movements. Once you plan, you have to execute. You have to contract certain muscles. You have to relax certain muscles. All this execution is done by cerebral cortex. And also control of the movements. It is not that I put my hand very fast and take the pen or book. It has to be coordinated. The movement has to be coordinated and controlled. Even the control and coordination of the movements is done by this cerebral cortex. Fine tuning based on the sensory input. So when I am moving or when I taking something, so there can be fire in between or there can be some chemicals in between. So I will take lot of sensory input from the nature, and if there is a fire, I will be moving my hand away from the fire and taking the pen. So based on the sensory inputs, I can adjust my movements and then take something. That is known as based on the sensory input. So all these are controlled by this cerebral cortex. Okay. So when there is damage to the cerebral cortex, so all this will be impaired. That is the important one you need to know. Next important structure is basal ganglion. Basal ganglion, you can see it is in the middle of the brain. It is deep inside the middle of the brain. So there are different nucleus. Nucleus means nucleus is the accumulation of some nerve body within the white matter. So there are a lot of structures in the middle of the brain. These different structures are known as basal ganglion. So what is the function of this basal ganglion? If this basal ganglion is damaged, what will happen to different types of functions? What are those functions? First one is initiation of movement. So to initiate the movement, you want to start the movement, then basal ganglion is necessary. And also control the speed of the movements. So if I want to take the pen, I cannot move it so fast, right? I need to control that. So speed of the movements is controlled by basal ganglion. And also execution of smooth movement. So if I am doing fine art, like I am painting something, so I am screwing something, or I am doing something with my fingers that is very fine. Not normally artists do it. Those fine movements are coordinated because of this basal ganglia. When there is a damage to this basal ganglia, all this initiation of the movements, control of the speed of the movements, and also execution of smooth movements will be lost due to damage of basal ganglia. Next one is cerebellum. Cerebellum is exactly located at the back of the skull, especially here. So normally people call in layman language as small brain. You can see this. This is the cerebellum. When there is damage to the cerebellum, these things are lost. And you can consider this. These are the functions of cerebellum. First one is tone. So your muscle should not be too tight or too loose. There should be control, or it should be somewhere in between. That is known as tone. That is controlled by cerebellum. And also balance. So when you are walking, when you are sitting, when you are standing, or when you are doing some activity, so you need to have balance in your body. If you don't have balance in your body, you fall down. So that balance is maintained or coordinated with the help of cerebellum. And also coordination. See, to do a work, different muscle has to be coordinated. So if I am punching someone, my left hand should go back and right hand should come front, right? There is some balance or coordination between my hands. And also when I am moving forward, I take my weight from the back of the leg to the front of the body. So all this coordination is carried out by cerebellum. When there is damage to the cerebellum, tone of the muscle is lost, your balance is lost, and your coordination is lost. So this is the importance of cerebellum in our body. Next important thing is, what are the causes why people are landing into cerebral palsy? There are three main reasons, three categories of reasons I can say. So what happened before birth, when the child is in the womb? So what happened? That is known as before birth or prenatal. We have to check during the birth, during the delivery, what are all the factors, and also after delivery, what are all the things that can hamper and cause cerebral palsy. First one is when the baby is in the womb, or when the mother is pregnant, she can have infections, right? Can be bacterial, viral, protozoal, any type of infections can cause the damage to the brain of the baby. And also mother health, like mother health is also very important. If mother is having diabetes or thyroid, or she is taking any toxic substance like alcohol, tobacco, or if the mother is on any drugs, this can damage the brain of the kid. Next, genetic mutation. There are a lot of genetic mutations that cause brain damage in the womb itself. So we can have some genetic mutations. And also placental insufficiency, this is one of the most common things. So you can see that in pregnancies, when there is more than one kid or one fetus developing in the womb, they can have less blood supply, or sometimes even with single fetus, so there can be constriction of uterine artery, or there are so many pathologies that can happen that reduces the blood flow to the fetus. So mother gives the blood to the fetus, right? There is a exchange of nutrients and lot of other things between mother blood and fetus blood. When mother blood is not giving sufficient nutrition or not taking out sufficient waste materials from the body of the kid, it can lead to brain damage, that is known as placental insufficiency. And also radiation exposure. There are a lot of radiations. When you are going through airport, you are exposed to radiation, or when you are taking any walking through, or there are a lot of places where you are exposed to radiation. So if the mother is exposed to radiation, especially in the hospital, or taking x-rays, something like that, it can also cause brain damage to the kid. So these are all the causes before the birth. Even child is born, these are all the risk factors or causes for cerebral palsy. Next one is, what are the causes during birth? So when the baby is about to born, or when the mother is in labor, what can happen? What are all the things that can go wrong? One is birth asphyxia. So immediately after the birth, the patient or the kid should cry. The baby should cry. If the baby doesn't cry, what happens is the lungs will not filled with oxygen, and the oxygen will not go to the different parts of the body, especially brain. So when the baby is in the womb, mother is breathing for him, and the oxygen is exchanged between mother and the baby. So mother is getting sufficient amount of oxygen. When the baby comes out, immediately the lungs has to function and give supply of oxygen to the brain. If the baby is not crying and the lungs are not expanding and the lungs are not taking oxygen, so it can cause hypoxic brain damage, means brain will get less oxygen. That's the reason brain gets damaged in the kids. That is known as birth asphyxia. Premature birth. So normally the baby should be in the womb for 9 months, and after 9 months the delivery should happen. Sometimes what happens is, even in 6th month, 7th month, or especially around 6th and 7th month, and early 8th month, if the baby is born, we call them as premature babies. Even that premature babies will have the risk or the cause of cerebral palsy. Low birth weight. Normally baby should have sufficient weight around 2 kgs, above 2 kgs the weight of the baby should be there. If the weight is below 2 kgs and even much lesser than that, what happens is it can cause the damage to the brain, that is known as low birth weight. Trauma during delivery. So there can be lot of injuries during delivery. There is forceps delivery, or cesarean delivery, or episiotomy, or suction delivery. There are a lot of different types of deliveries during this delivery, or vaginal delivery, natural delivery. Even during natural delivery, they can be pressure or they can be mechanical injury to the brain. This can cause cerebral palsy. And coming to the risk factors and causes after the baby is born, first one is infections, especially infections to the brain and meninges. Meninges are the coverings around the brain. Brain is well protected in some covering. Those coverings are known as meninges. So if there is direct infection to the meninges or the infection to the brain, that can cause brain damage or head injury. So we can see lot of injuries when a baby is carried or put somewhere, or when someone is shaking the baby or playing with the baby, there can be head injuries as well, which can lead to brain damage. So neonatal jaundice, one of the common diseases. So some people or some kids are born with jaundice. It can be pathological jaundice or physiological jaundice, whatever, pathological jaundice or physiological jaundice. If the serum bilirubin levels are too high for a long time, that can cause cerebral palsy as well. Lack of oxygen and choking. We can see some of the kids when we place them on cradle or when we place them on cot, they can, something can fall on their face, a cover can fall or a cloth can fall, and she will not be able to respond, and the baby will not be able to speak. At that time, what happens is there will be damage to the brain, damage to the brain. When you cover his face with something else, so he is not able to breathe and there is no sufficient oxygen to the brain, that can cause brain injury. So this is known as choking. And also there can be sometimes clots and bleeding due to any reason. So there are some diseases that can cause clots in the brain of the baby or bleeding in the brain of the baby. This can lead to brain injury. So these are all the causes after the birth. Then coming to the risk factors, what are the risk factors? So multiple birth. Multiple birth means if there are twins or triplets or quadruplets, if there is less space and more people within that space, that is one of the risk factors. Advanced maternal age, if the mother's age is too high, so normally we see nowadays with the celebrities, they are going with the kids at later ages. So even that is one of the major risk factors for cerebral palsy. Next one is complications and the labor during pregnancy. So some of the people will be pushing for normal delivery, even though doctor suggests that to go with LSCS, or they want to go to natural delivery. Even that conditions, they can be damage to the brain. And also neonatal infections, any infections of the children. So it can be bacterial, it can be viral, it can be protozoal or parasitic infections, can cause cerebral palsy in the later stages. These are all the risk factors for cerebral palsy. So once you have the cerebral palsy, what are all the changes that gets in the brain or in the body are known as body changes, and this is also known as pathology. Cerebral palsy is the damage to cerebral cortex or basal ganglion or cerebellum. So you have to understand these things very clearly. Next, you have to understand when there is damage to cerebral cortex, what will happen? This is known as spastic cerebral palsy. In spastic cerebral palsy, what happens is all your muscles become stiff and your movements are not coordinated. What happens in this? You will have muscle tone will be lost, and also there will be lot of hyperactive muscle reflexes. Your reflexes of the muscles increase, and there will be lot of resistance when you want to move his body, or when you want to move the part of his body, there will be lot of resistance. The muscles become so rigid. Spasticity means rigidity. So if there is a damage in the cerebral cortex, so this upper part or outer part of our brain, so this will be the effect. These are the symptoms that are seen, and this is the most common type of cerebral palsy. 70 to 80% of the people who are suffering with cerebral palsy will be landing into spastic cerebral palsy. This is the common one among the all the cerebral palsies. Next one is dyskinetic cerebral palsy. You can see when there is problem with the basal ganglion, when the basal ganglion, which is located deep in the brain, is damaged, land into dyskinetic cerebral palsy. Dyskinetic cerebral palsy, there will be lot of involuntary and uncontrolled movements. So the main function of this basal ganglion is to control the movement, that is lost. So you have lot of involuntary movement. For example, if you want to take the pen, you have to go straight and grab the pen, right? No, it will be shaky like this. Okay, so there are a lot of involuntary movements when you try to perform a voluntary movement. And also muscle tone fluctuates. So sometimes the muscle becomes strong, the sometimes muscle become weak, your muscles become rigid, sometimes your muscles become flaccid and loose. So a lot of changeability you see when there is damage to the basal ganglia. The movements can be slow, you cannot be fast. So someone asks you to grab a pen or glass of water, you cannot do it quickly, you have to do it very slowly, and also there can be jerky movements. So you cannot do there cannot be smooth movement and without jerks. So basal ganglion is damaged, there will be jerks as well. And the third variety of cerebral palsy is ataxic cerebral palsy. Ataxic cerebral palsy is caused due to damage of the cerebellum. Cerebellum is the part of the brain located behind the skull, lower part of the skull and behind the skull. So if this part is damaged, what will happen? The important damage is going to be to the balancing. While walking or sitting or doing something, you cannot have balance in your body. That balance in your body is lost, and also there will not be any coordination. There will not be coordination between your hands and between your legs and hands, or any part of the body. That coordination is lost. And also gait. When you are walking, you cannot walk normally. There can be widening gait or different types of gait, and stability problems are associated with these persons when their cerebellum is damaged. These are the various kinds of cerebral palsies. Next one is mixed cerebral palsy. We have seen three types of cerebral palsies, right? But in a patient, it will not be separate. One patient cannot have only one types of cerebral palsy. It will be a mixture. Sometimes symptoms of one variety can be more, symptoms of one variety can be less, but it is always a mixture. That's the reason we call as mixed cerebral palsy. Pure cerebral palsy, getting only one type of cerebral palsy, is very rare, and normally for 95% of the patient it will be mixed. It will be dyskinetic. They will have some symptoms of dyskinetic cerebral palsy or ataxic cerebral palsy or spastic cerebral palsy. So it will be always a mixture of these symptoms in a patient. That's the reason we name it as mixed cerebral palsy in most of the cases. What is a conventional treatment? Conventional treatment is a treatment you take while going to a corporate hospital or a neurologist or allopathic medicine or English medicine or Western medicine. You have different names for it. So what are all the common medicines they give? They give medicines based on the symptomatology. There is no cure with them for this disease. First one is muscle relaxant. They will relax the muscles. And next one is anticonvulsions. When you have fits, they will give medicines for the fits. And also anti-inflammatory and painkillers. When there is a lot of inflammation in the body and also a lot of pain, they will give painkillers. When there are a lot of fine movements or tremors, they will give medicine for that as well. And all the medicines are symptomatic. And also when there is excessive damage to the joint or excessive involuntary movement, they will cut the nerve, or they will reverse the damage to the joint, and they will do surgery as well in some of the cases. What happens when you have this? Instead of having permanent cure, you will not have permanent cure, and also you'll be landing into a lot of other complications. So there is no improvement because of allopathy, and also no cure, and also it is full of side effects. You can see that painkillers, anticonvulsants, anti-inflammatory painkillers, and all the other medicines which you take from conventional medicine will have a lot of side effects, and it is not the preferable method of treatment. And coming to homeopathic treatment, homeopathic treatment has a lot of advantages in cerebral palsy. There are specific medicines in homeopathy to treat the cerebral palsy. All these are without side effects. You will not have even single side effect because of homeopathic treatment. And also, what is the efficacy? How efficient is homeopathy in cerebral palsy? For example, in different diseases, we can say different success rate. Psoriasis 50% success rate, vitiligo 50% success rate. In the same way, cerebral palsy has greater success rate. The success rate of homeopathy in cerebral palsy is more than 90%. Almost all the patients I have treated for cerebral palsy has improvements in their symptoms. So sometimes the dependency can be reduced, the pain can be reduced, the discomfort can be reduced. So lot of things can happen over a period of time when you are on the treatment for cerebral palsy, and homeopathy is the best treatment available for cerebral palsy. So what are the precautions you have to take for cerebral palsy? First one is you can take occupational therapy, speech therapy, or physiotherapy, or the combination of or all of this. That will be helpful the patient. Along with the homeopathic treatment, you can consider any of these. And what happens when you neglect cerebral palsy? Cerebral palsy is not a deadly disease. It will not progress. People think that all the diseases will progress. This disease will not progress. So when you neglect, what happens is it will not progress, but you will stuck in the same place for a very long time. But instead of doing that, take homeopathy. Homeopathy has the best answer for this cerebral palsy. We are Fidicus Homeopathy. For consultation, you can contact on 7997 Wherever you are in this world, we have two options for you. One is online treatment and one is in-person treatment. Online treatment, you can make a video call or audio call. We can see the patient directly and evaluate him. And also, if there are any reports available, you can send it to us. We will see the reports. If any other investigations are needed, you can get them done and send it back to us. Or if you want to consult us in person, call to this number and inquire about the nearest branch to you. We have multiple branches, nearest branch to you, and you can meet us in person. You can reach out to us on 7997 or you can go through our website as well. So why Fidicus Homeopathy? Fidicus Homeopathy has the highest success rate for cerebral palsy compared to all other homeopathic doctors or individual doctors or corporate homeopathic clinics. We have the best doctors with us. We have the highest success for cerebral palsy. You will be having transparent treatment. All the things which we say are black and white, and also personal care with us. So that's the reason you have to consider Fidicus Homeopathy for cerebral palsy. Thank you.